Hello, I'm Dr. Thomas Barnes, Newport Beach cosmetic surgeon for more than 17 years. As a physician, I'm interested in all areas of medicine just like many other doctors are. On Expert Voices, we're going to have cutting-edge leading experts in all areas of medicine who are going to share their secrets with you on how you can lead a better life. I hope you enjoy this episode of Expert Voices.
Orange County Registered Digital.
Stem cells have the potential to repair damaged or sick organs and even regenerate new tissue in the body and grow new organs. Now, new technologies allow us to harness the power of your own body's stem cells found right in your own body fat. Joining me today is Dr. Julian Whitaker of the Whitaker Wellness Institute, an integrative medical clinic in Newport Beach. Whitaker Wellness offers the most comprehensive range of non-invasive treatment alternatives in the nation. Dr. Whitaker?
Hey, my pleasure.
Such a pleasure to have you. Can you tell us what are stem cells so people know?
Well, stem cells in the body, they are located in the fat cells around in the blood cells. They have the ability to transform into a nerve cell, a bone cell, a cartilage cell, a heart cell. They have retained that flexibility. They also tend to stimulate the cells that are already working, but they are activated. So stem cells go in and create better conditions of the cellular workup and the cellular makeup of the individual that receives them. It's really dramatic.
And who can benefit from stem cells? You hear a lot about stem cells today. We're talking about adult stem cells.
Right, adult stem cells. We're not only talking about adult stem cells, but we're talking about your own stem cells. You see, the stem cells are harvested from a liposuction technique with a small amount of fat coming from usually the abdomen area. And then these cells are isolated and extracted from the blood vessels around the fat. It's interesting that most people don't realize that the fat tissue harbors more stem cells than any other organ in the body. It's loaded with stem cells. Has more than the bone marrow. And so these are the cells that we get. The stem cells in fat, they're not active. They've been on vacation their entire life. We got to get them out and put them to work.
And most people have enough.
Oh, they have plenty, and they'll make more.
So I really want to make this clear to our viewers today. This is really important. It's your own cells, your own fat cells that we can get the stem cells from to use in your own body.
Exactly.
For various conditions or diseases
right.
to improve things.
Right. And a lot of these conditions are multiple, like arthritis. You know, you have knees, you have neck, you have shoulder, and all of a sudden you give in some intravenous stem cells and everything feels better. Let's see, Parkinson's disease. You know, rips people apart. But we've had patients that are able to dramatically regain their life after stem cells. They can walk, their tremor goes away, they exercise, they're happy as clams. Total hips. Now look, I've had some training in orthopedics. I would never criticize a total hip. I think it's one of the best operations that has been devised in a long time. But here was a guy that the doctor said, look, we've done everything we can, you're going to need an operation. So he said, well, I want to go to something else. He went and did stem cells. Now he's able to walk, he's able to run, he gets up in the morning, he doesn't have any limp, and he's happy.
Well, let me interrupt for 1 second. I think it's important. Viewers are asking themselves, how quickly do they see a result?
The stem cells will produce a result first couple of weeks. Then there's a gradual and a continual improvement over that time as these cells kind of get to work. It is not a complete cure, but it is a prolonged improvement. And since the operation is very minimal in terms of pain or danger, you know, they may want another one in a year and a half, something like that.
Well, you know, another thing that people ask me about all the time in my practice is, if you use stem cells as you use them, do you have to use any drugs, or actually people can decrease drugs they take for pain if they're using stem cells?
Oh, absolutely. There's no drugs required for the surgery or except to go to sleep or as a part of the stem cell treatment. You may have some for pain afterwards, you know, a couple days. But in general, it causes the benefit to create that you don't need any more drugs. And that's what's good, where they're actually feeling so much better, they're walking, they're living their lives. And
now you've had so many people with great testimonials. You're actually improving people's lives using their own adult stem cells, correct?
Exactly.
Can you tell us, you mentioned one story before, can you tell us some more stories on how you've helped people that have conditions?
Well, this lady had chronic obstructive pulmonary disease for 10 years. We gave her some stem cells. Today, after the stem cells, she's able to run her own business. She does aerobic exercise 4 days a week, and she feels fantastic.
And I just want to recap one point. Everybody's heard about the old embryonic stem cells, but we're talking about using your own stem cells now, not embryonic, using your own stem cells and fat. It's a natural process, low risk, isn't that true?
It's very low risk. We work with a plastic surgeon similar to you. He goes in, does a mini liposuction on the abdomen. Now don't come in expecting them to take away all the fat on the abdomen. That's not the purpose, but a mini liposuction. Then we hydrolyze the fat, we isolate the stem cells, we put them back into a solution, we heat them up a little bit, and then we inject them back into the system. It's their cells. And we tell those stem cells before we put them back in, say, okay guys, go to work. And they do.
Thank you for joining us.
My
This
pleasure.
has been fascinating. In fact, I'm going to keep going visit him in his practice and learn more about this myself. For me, thank you very much for joining us today, Dr. Whitaker.
My pleasure. Thank you.
Stem cell therapy has been controversial in the past because of its association with human embryonic stem cells. However, there is nothing controversial or unethical about using your own adult stem cells in a safe and therapeutic manner. It's the future of medicine, and that future is now at Whitaker Wellness. Call for a free consultation with a patient service rep, 866-232-6167.